Hello, I'm Dr. Leyla. I'm a holistic pharmacist and author, and this is my book. It's Off Balance, The American Way of Health, a pharmacist's perspective on why drugs don't work. Today I want to talk about medical doctors. And for many of us, whenever we're sick or we have a health concern, maybe we need a specialist or a referral, for many of us, the first stop is a medical doctor's office because they are the center of the healthcare system. But should they be? So if you want to see more videos like this, please subscribe to my YouTube channel, and also my book is available on Amazon. The link is below. But for now, let's jump right in. So if we go back to the 1900s, the patient had a lot of choices in healthcare, and the doctor was on the even playing field with traditional Chinese medicine practitioners. There were herbalists, a naturopathic medicine doctor. There were energy healers, as well as holistic health, homeopathy. The patient could make their choice. And then in 1910, the American Medical Association hired Abraham Flexner to review all the medical schools in an effort to standardize medicine. For 25 years past, there has been an enormous overproduction of uneducated and ill-trained medical providers. So they had a lot of different schools, many schools. The entrance requirements were, some were very different, some were almost nothing. The length of education, what they learned was all varied, and so they wanted to get a little standardization in it. And so Flexner went to all the different schools and he made a report on what they needed to standardize them. But the American Medical Association actually works to promote the profession of medicine. And so, pushed by Rockefeller, at this point they're able to motivate Congress to declare the American Medical Association the only group authorized to grant medical school licenses in the U.S. So all of a sudden, the American Medical Association has all the power. The schools that followed their guidelines were able to get major funding from the Rockefellers and Carnegie foundations. So in an attempt to so-called standardize medicine, the actually real goal was to push out anything that was natural, alternative, or holistic, even practices that had been around for hundreds of years or thousands of years. And then some pharmaceuticals came out that built a lot of confidence in Western medicine. Miracles of medicine, penicillin, sulfa drugs, blood plasma. So when these antibiotics came out, they saved people's lives from things that they would die from. These soldiers would go, they would get gunshot wounds or other wounds, and they could often die from infections until penicillin came on the market, and it could save lives. It healed things like diphtheria, pneumococcus pneumonia, gonorrhea, and other things that people would literally die from. So it was a huge progress and breakthrough. Here's another one. Thanks to penicillin, he will come home. So again, people started loving these pharmaceutical drugs. And then there's some other breakthroughs, of course, that came. 1920s, insulin started becoming available for diabetics. The 1950s, we saw birth control pills and steroidal anti-inflammatories like cortisone that helped with inflammation. 1980s, we have Prozac for depression. And of course, 1990s, we have Viagra. The little blue pill for erectile dysfunction. Again, there's a lot of hype and money behind the pharmaceutical drugs, and there's a huge desire for them. So they became the mainstream even more. But now, so with all this funding going to the medical schools by the Carnegies and the Rockefellers, of course they're going to influence their education to learn what they want. So at this point, they influence the doctor's education more and more. The doctors stopped learning about the basics of health, like nutrition and emotional health and natural products, medicinal products that they probably learned for hundreds of years, and if not thousands, and now all of a sudden they're just learning about pharmaceutical drugs. Medical doctors and pharmacists start becoming extensions of the pharmaceutical companies instead of having that whole education on health. And then the insurance companies come in the picture, right? So now we have doctors being educated by pharmaceutical companies, and they're limited by the insurance company. So there was a time when I was working when people would come in and say, of course it's covered, I have insurance, right? And they don't say that anymore. Now there's formularies. You can't have whatever you want just because you have insurance. Everybody knows that. So now we have the two big players of insurance and pharmaceutical companies. They're controlling the medical doctors, and the patient is over in the bottom left corner. They're not that relevant. You're going to get a medication that's covered on insurance. And all the other natural and alternative medicine practitioners are in the other corner, and they're still irrelevant, quacks, not covered on insurance, and certainly not mainstream medicine. So this is our medical doctor. This is the center of our healthcare system, and this is a huge problem. When people talk about what's wrong with our healthcare system. The problem is we go to a medical doctor first who's not trained in health. And we need to get this corrected. And a lot of times medical doctors don't know it. Again, not to rip on medical doctors, even though obviously I am, but they go to school, trained, come out with hundreds of thousands of student loans, and they're not trained in health. And a lot of medical doctors, they continue their education because they want to do the best for their patients. And they shouldn't have to do that, but they could go on and they get extra training in functional medicine or nutrition. And then there's some doctors that are aware of it and they say, hey, what about natural medicine? At least they're open to it, right? So those are good doctors too. They're aware they have limitations. And then there's those arrogant doctors, and they put down everybody else. And those are the doctors you want to avoid. You know, the one that call them quacks or anything, if they're not open-minded, if they don't understand that their own education has some severe limitations, then get away from those doctors. But again, I understand medical doctors and pharmacists go to school with the best of intentions to learn health and to help people. And the pharmacy schools, the medical schools have all been hijacked by these pharmaceutical companies, and many of the people don't know it. The patients don't know this, and the practitioners don't know it, and a lot of us are just puppets working for these big companies. So doctors went from being one choice of many on a level playing field to the only choice after the Flexner Report, the most important and the mainstream one, to really just extensions of the pharmaceutical companies and the insurance companies, not trained in true health anymore. And here's some better options if you want to do better for your health and get better opinions. And again, a lot of these aren't covered on insurance. They may not be, but that shouldn't be your only factor. A lot of times you'll get a lot more out of paying cash for one appointment here than a bunch of Western medicine doctors. There's naturopathic medicine doctors, and these guys are trained in medical and natural sciences, and so they'll have training in both. They believe in healing power of medicine, identify and treat the cause. There's functional medicine, and this is an extra training that a lot of practitioners can do, pharmacists or medical doctors, and they focus on identifying and addressing the root cause of disease. So if you see somebody trained in functional medicine, that means they've gone beyond their education of standard medical schools, and they want to learn more, they want to do better. So these guys are excellent options as well. Integrative medicine, they combine practices and treatments from alternative medicine and conventional. So again, they're acknowledging that Western medicine may not have it all, and they want to give both approaches. So those are also great choices. Traditional Chinese medicine, that's the traditional Chinese medicine that's been around for thousands of years and includes acupuncture, herbal remedies, lifestyle. It's a whole system of medicine on its own, and it's survived over thousands of years. So for chronic diseases, pain, and some different things, it's an excellent choice. And Ayurvedic medicine is one of the oldest medicine systems in the world. It's a practice in India, and that includes herbal remedies, lifestyle, yoga, meditation, and again, an excellent choice if you want to do better for your health than doctors and pharmaceutical drugs. So again, we need to go back to this, where the patient is the most important, and they have choices between all the different practitioners and say a doctor. Right now, if you ask a medical doctor about holistic or alternative healing, they're not trained to learn that. Some of them may learn it on their own, but it's not their standard training. So again, part of being part of a capitalistic society is everybody wanting to make that money. They want to do the best they can for you and make that money. So if we go back to this, where the patient becomes first, the patient's needs, and you get referred to different practitioners that can better help you, patients are empowered to take control of their health. And of course, these choices should be covered on insurance, and they're not right now. Thank you for watching. Please remember, medical doctors are the center of the healthcare system because we live in a capitalistic society that needs to make profit. For true health, we have to consider nutrition, detoxification, emotional health, a natural product if there's one available, relationships, all kinds of things. If you go to a medical doctor, they're going to give you a pharmaceutical drug. So what does that mean? That means that people now are struggling with their health, taking pharmaceutical drugs for years when there's simpler solutions. If you want to see more videos like this, please subscribe to my YouTube channel. If you'd like to order my book, it's on Amazon. The link is below. And also I have a Patreon account if you want to support this kind of message, and I can keep making and sharing these videos. Again, there's better solutions out there. People are struggling for years when they don't need to. And if you know anybody that can use this message, please share the video as well. And thank you so much for watching. I'm Dr. Leyla Ali.